Welcome! This series of tutorials aims to inform diagnostic laboratories about the new regulation on in vitro diagnostic medical devices, the IVDR. Please note that the implementation of the IVDR is an ongoing process and many aspects remain to be clarified. This means that new information will become available continuously. Please visit the ESLO website for more information. 6. Preparatory Action 3. IVDR Compliance. Action 3 concerns compliance to the IVDR requirements for in-house devices. To achieve this, it is useful to start with a gap analysis, looking at which data, procedures and documents you are missing to fulfill the IVDR requirements. This concerns the Article 5.5 conditions and in particular the general safety and performance requirements in Annex 1. As mentioned before, there is a substantial overlap between the requirements of Annex 1 and ISO 15189. The ISO norm applies to the whole process chain in a diagnostic laboratory, including management, personnel, accommodation, equipment, reagents and reporting. And the IVDR zooms in on medical devices, or in-house devices. So this means on equipment, reagents, software, etc. A good starting point for determining how to fulfill the IVDR requirements is a paper published in CCLM by the Dutch task force IVDR. This task force consists of representatives of a number of relevant national medical societies. In the publication and the supplementary info, they give their interpretation of the Article 5.5 conditions, and also they made a useful cross-reference table, comparing the IVDR Annex 1 with ISO 15189. In this table, they show which requirements are overlapping, and therefore compliance with ISO 15189 could mean that you already comply with the corresponding IVDR requirements, and they also indicate which requirements they regard not to be relevant for in-house devices, and which requirements are new and would still need to be addressed. This is not an official guidance, but it does give a multidisciplinary perspective, and input from different stakeholders, including industry and the Dutch competent authority, has been taken along in the final version. However, because every specialization and every lab is different, it is important to also look for other sources of information and determine for yourself what you still need to do to fulfill the requirements in Article 5.5 and Annex 1. Without a doubt, the official guidance document on in-house devices, other publications, and also guidelines that will be developed by diagnostic labs will be useful in the process of determining a strategy for reaching IVDR compliance. Also, it is good to realize that it is still early to reach full compliance in an efficient way. On the other hand, there are some steps that you can already take to work towards compliance with the IVDR. It is, for example, possible to evaluate the extent to which you already fulfill Annex 1 requirements, for example, based on the aforementioned template comparing this annex with ISO 15189, and also to update verification and validation procedures, and to check whether you already have data on all required performance parameters.